true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back, everyone, to another episode of You and Your Doctor. You sponsored by All County Healthcare. You're able to listen to us on 96.9 and 95.3, and you're able to watch us on amp2.tv. I am your host, Rayma Phillips, and today we have a very special guest with us today, Dr. Jonathan Kahn. Jonathan Kahn is a board-certified and fellowship-trained cardiologist. He works out of the South Florida Heart Institute.
Yeah, can you hear me?
Hi, yes, how are you?
Yeah, go ahead and proceed.
Hey, I'm good. How are you?
I am doing well. I was just getting ready for your intro. How are you doing today?
I'm good. Having some technical difficulties, but I'm doing okay.
It's all good. We're very, very honored to have you on the show today, Dr. Kahn.
Thank you. Honored to be here.
So just continuing, Dr. Kahn has his own practice. It is called Palm Beach Health Network Physicians Group, and they are located at 5035 via Delray and Delray Beach, Florida. And you're able to reach them at 561-637-0500. So, yeah. Dr. Kahn, so let's just jump right into the interview. Can you tell us, our listeners and viewers tonight, a little bit about your medical background?
Sure, totally. So I'm Canadian. I've been living in the States for probably 12 years already. I did all my training in New York. I did my residency at St. Luke's Roosevelt, which was Columbia University at the time. And then I did my cardiology fellowship at Winthrop NYU. And I've been with my current group for over 6 years.
Wow, that's definitely an extensive resume right there for sure.
Thank you.
So I have a few questions here to start off with today. So being a cardiologist, can you tell us a little bit about coronary artery disease?
Sure, absolutely. So if you look at the heart, it needs blood just like every other organ or tissue in the body. And the way that the heart gets blood is by pumping itself, that blood through the coronary arteries. When there's disease in those arteries, plaque buildup, blockages, the heart gets starved for oxygen, which can damage the heart, leading to a number of, problems down the road.
Absolutely. So would you say that coronary artery disease is one of the leading causes of heart attack, especially nowadays?
Right. So it is the cause of heart attacks. If you look at where we're at in terms of heart disease in America, heart attacks and strokes and coronary artery disease kill about 800,000 people a year.
Oh, wow.
So it's the leading cause of death in America. The sad thing about this is that a lot of it is preventable. And one of the most common presentations of heart attacks, as you mentioned, is actually just dying. Okay. So we can prevent these things from happening, but at the same time, Once they happen, it's more difficult to fix.
That definitely makes a lot of sense, and that goes for a lot of the chronic diseases out there for sure.
Absolutely.
So with this disease that people develop, what are some lifestyle changes that can help people prevent some of these chronic diseases from affecting them in their future?
Right. So I think that that's one of the best things about cardiology is that we can prevent 90% of these diseases from happening, and that's not true in other areas. And so, if I run the list of lifestyle choices, the first one is don't smoke, and we're actually doing a pretty good job there in terms of seeing the cigarettes come down, but now you're seeing with the younger kids, you're having the vaping come up, and
That was
that's going
actually
to.
about to go into my next question. Is vaping kind of taking the place of cigarettes for this newer generation?
Yeah, so I definitely think so. I think it's a double-edged sword because vaping is not technically as bad as cigarettes, but what it does do is lead to that addiction that then moves them back into, vaping and cigarettes and, causing those problems. So while it
Absolutely.
is helpful to quit, you can use, nicotine replacement products like e-cigarettes. Again, it's so similar to smoking that they just continue it.
Okay, thank you for that for sure. So, what are some dietary changes that people can make within their own lifestyles to kind of steer them away from the coronary artery diseases from developing?
Right. So that's a great question. I think that when we look at which diets work the best, the number one that keeps coming up is a Mediterranean diet. And that's going to be, high in fish, high in olive oil, high in, vegetables, leafy greens, that sort of thing, lower in red meat and lower in those saturated fats.
No, that definitely makes a lot of sense. So that is definitely very interesting because a lot of people don't know about the simple dietary changes that can help prevent a lot of these chronic diseases from developing, as well as a mixture of physical fitness as well. Little things that can help.
So I'm really happy you brought up physical fitness because I think people see it as this little thing, but it really isn't. I mean, we will never be able to build a pill or medication or some intervention that can replace physical exercise. And so doing, 30 minutes every day of whatever you love to do, walking, swimming, running, weights, doesn't matter, is going to help out tremendously.
Absolutely. I definitely agree with that. I work as a personal trainer and I tell people every day that fitness saves lives and just keeping your body active and moving. You don't have to be in the gym lifting heavy weights, but even going on a walk every day or just like walking your dog or going on a swim does amazing things for your body as a whole.
Oh, absolutely. And people really underestimate how much it helps.
Absolutely. I'm very happy we're able to touch on that aspect. So, moving forward, can you talk about any other chronic diseases that affect the heart that you see often as a cardiologist?
So one of the things I deal with the most is probably high blood pressure. So by definition, that's going to be a blood pressure of greater than 130 over 80 most days. And people, it's called the silent killer for a reason because it leads to, heart attacks, strokes, death, and all the bad stuff that we're looking for. But people don't feel it until it's too late. Typically, people won't even, measure their blood pressure unless they know there's a problem. And it affects 1 in 3 Americans. So that's over 100 million people at this point.
No, definitely. So, what are some things that you give to your clients or some of your patients to help combat some of these high blood pressure issues that they may be facing?
Right. So I think traditionally people have just thrown, antihypertensive or, blood pressure medications at people. But I think what we're really finding is that if we address the lifestyle issues that we talked about, smoking, being overweight, not exercising, not eating right, we can control a lot of that blood pressure. Um, some of the over-the-counter medications like ibuprofen, Advil, Aleve, can actually cause high blood pressure. People are, taking these medications every day for headaches, et cetera, and they don't realize how bad it is for them,
So, how do ibuprofen, Aleve, and all those
knowing that it's actually fine.
and that's something that people take almost on a daily basis. Like when you ever have any type of pain, you just pop in an ibuprofen or some Tylenol to make it go away.
Absolutely. It's really shocking what you can just buy in a pharmacy. These days you can basically get almost anything.
So, what do you tell your patients who are dealing with high blood pressure? Because I heard that stress is also a big factor with high blood pressure. What do you do for your patients who are experiencing very high, stressful type of lifestyle?
Absolutely. So, again, we all have stress. Everyone's life is, really difficult. We're, go, go, go all the time. And so, what I say is to just take a few minutes to just relax, slow it down. And, when we talk about things like meditation, we aren't talking, necessarily about woo woo stuff. We're really looking at things that, just sitting in a quiet place for a few minutes, watching your breath can make a huge difference. Another area that can make a huge difference is restaurants. So, for example, you go to a restaurant, you have a salad. That salad may have 6 grams of sodium in it, and so people are wondering why their blood pressure is high. It's because they're eating at restaurants so much, and they're adding the salt to make the food taste better.
That definitely makes a lot of sense as well. Eating out is you have to be so careful eating out because when
Yeah,
you cook at home, you're able to measure and actually see everything that is going into your food. But when you're eating out, even a salad can spike can spike your blood pressure if you're not careful.
absolutely.
That is definitely extremely important as well. So I also learned that you also work in preventative cardiac measures to help people prevent a lot of these chronic diseases. What do you do with your patients when it comes to preventative measures?
So I think what happens is when patients come see me, they typically have, an acute problem. Oh, I'm having chest pain or I'm having difficulty breathing. But what a lot of doctors don't address is the underlying conditions, the underlying problems. And so what I try to do with every interview, are you exercising enough? How's your diet? How's your mood? How's your stress? And looking for those sort of risk factors that we can modify to prevent, diseases from happening.
And what about your patients who are unable, like your older patients who are unable to do as much physical fitness or move around as much? What are some things that you would do for them as well?
Right. So, and I think with my elderly patients, and we're in South Florida, and so this is very common to have much older patient population. Is I think people come in with this conception that they need to do a marathon every day, or just lift weights for an hour, but they don't have to do that. They can come in. They can do, walking, swimming is a big thing. That's easy on the joints, but great for the cardiac health. And even light weights is going to make a huge impact for them.
Absolutely, absolutely. I tell my clients the exact same thing. You don't need a lot, you just need a little bit to make some of the biggest difference within your lives.
Correct, definitely. And one of the things we look for is, for example, with my female patient population, they'll check their weight every day, and their weight is going to be stable. But what's actually happening is they're losing that muscle mass and just continuing with the fat. And muscle weighs 4 times more
Exactly.
than fat, so they don't realize that they've lost that muscle mass. So getting back in the gym, getting with personal trainers such as yourself, is going to make such a huge difference for them.
Absolutely. I definitely agree with that. But we are about to go into a commercial break real fast. So we'll be back just after this commercial.
No problem.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, sponsored by All County Healthcare. Again, we are here with Dr. Jonathan Kahn, and I am your host, Rama Phillips. Welcome back, Mr. Jonathan Kahn.
Thank you.
So moving forward, I would love to dive into a little bit about your practice in Palm Beach, and Delray. I'm so sorry. In Delray Beach, Florida.
Absolutely. So we are one of the larger cardiology groups in the area. We have an office on Via Delray and South Military, as well as in Delray Medical Center. We do teach the cardiology fellows at Florida Atlantic University as well.
Oh, wow.
Yep. And we have a number of subspecialties, including structural cardiology, advanced heart failure, and we cover everything in between.
That's very interesting. So for our listeners tonight, do you mind walking us through a day in your life at work dealing with your patients?
Sure, absolutely. So my days typically mix between covering, Delray Medical Center Hospital and seeing patients in clinic. I'll move back and forth between those two. We also do a lot of imaging for the hospital, including ultrasounds of people's hearts, stress tests, cardiac CT scans, angiograms, and basically everything. We're kind of a one-stop shop for cardiology.
That's definitely a big plus, especially for your patients who need to get some work done.
Absolutely. Absolutely. We basically cover everything.
So I also saw here that you also do echocardiographs, and I know those are super important when you're trying to really see what's going on within someone's heart. Can you tell some of our listeners and viewers today what an echocardiograph is and how it helps?
Sure, totally. It's kind of like a ultrasound of your heart. So, if anyone's seen an ultrasound for a baby that looks kind of the same, except we're looking at the heart. You do need special training to read them. Even if you're a cardiologist, you sort of go beyond that and get some special training. And it's sort of our utility tool to diagnose multiple chronic conditions and acute conditions.
That's very interesting for sure. And how does the echocardiograph differ from the cardiac defibrillator monitoring?
So echocardiogram is ultrasound of the heart. It's an imaging test that really actually doesn't have any side effects, which is great too. There's no radiation involved, and we can see how the heart's functioning structurally. When you talk about things like defibrillators, you're looking at more the rhythm of the heart, which is the electricity of the heart or how the heart beats.
So, and in what situation would a cardiac defibrillator be used?
So we use cardiac defibrillators in a number of scenarios. The first one we use them for, probably the most common, is for people with weak hearts. We use them as insurance. Basically, people with weak hearts can go into arrhythmias that can be fatal, and the defibrillators basically prevent that from happening. And so it's kind of like an insurance for us.
Oh, that makes sense. Is it kind of like the defibrillators that they have in the emergency kits
On the
at different
shows.
places? Yeah.
Yeah, totally. So that's exactly the same. It's just, inside your body. It's a little disc. It's very tiny. You can't even see it anymore. But we do use the external defibrillators sometimes, hopefully rarely, not as much as the shows would like to show you.
I was about to say in the shows, it's like the to-go-to tool that they use to keep
Exactly.
people alive.
Every time. I wish my job was that exciting.
For anyone watching, do not get your medical advice from Grey's Anatomy. So this is a great segue to move into a different topic. So what is congestive heart failure? I know that is something that is talked a lot in the media and just within our day-to-day lives. So can you tell us a little bit about what congestive heart failure really is?
Absolutely. So there's two different types of congestive heart failure. The first one is called systolic heart failure, and the second one's called diastolic heart failure. Now, those are fancy names for very simple concepts. So systolic means that the heart is weak. Diastolic means the heart is stiff. So you can have those two different kinds of heart failure. And typically with the weak hearts, what is happened is there's some sort of acute event like a heart attack or something happened to the patient's heart to make it weak. We actually have really good treatments for that. In terms of medicines, medicines and interventions. The tougher one to deal with is actually the hearts that are stiff. This is from things like we talked about, like smoking, aging, high blood pressure. And up until recently, we actually did not have any great treatments for it. But what's been really exciting in the past couple of years is we've started to have some new medicines come out that are able to treat this condition, which is something we haven't had the ability to do for over 40 years.
Wow, that is absolutely huge right there for sure.
Yeah, absolutely.
So you're really going to be able to save so many more people's lives with these new medications coming out.
Correct, absolutely. And so it really is going to make a big difference in our clinics, and we're seeing the impact already.
That's super big right there, for sure. So when it comes to congestive heart failure, and when we talk about things that we can do for preventative measures, are they the same things that we would do for different chronic diseases?
Yeah, absolutely. Again, cardiology is simple. It's really about just doing being active, eating right, being healthy. And I think that people don't see that as these medical interventions, but they really are. And so we can prevent 90% of cardiology can be prevented by doing these measures.
That's very interesting. It's so big, and I definitely agree with you. So, as a cardiologist, I have an interesting question for you. As a society, we are very focused on if we have an issue, there's a medication to fix that issue, and that is what you need. Would you say that you deal with some patients who may not think that the dietary fixes and the exercises are going to have as big of effect as some of the medications that you would give them?
Oh, absolutely. And when we study this stuff, we see this massive outsized effect from things like exercise and eating right and, being healthy. And so the medications do help, of course, but that isn't sort of the answer to preventing, a lot of these chronic or, acute conditions.
So it's more of a Band-Aid fix versus a lifetime fix.
Yeah, I think you definitely have some drug classes that are, very, very helpful, such as the cholesterol-lowering medications, which, have been across the board shown to be beneficial. But I think, rather than dealing with the problem after the fact, you can, do these lifestyle changes and prevent the problem from happening in the first place.
Absolutely. Again, I definitely agree with you on all those points for sure. So I know we touched on this topic a little bit, heart arrhythmias. So
Yeah.
can you go into a little bit more detail about why it's important to make sure you have a healthy heart and you are able to find out if you do have an arrhythmia, and how can it affect you if it does go untreated?
So this is a fantastic question because things have actually changed in the past couple of years. And I think it's important that people know that. So if you look at the most common heart arrhythmia in the world, it's something called atrial fibrillation. In atrial fibrillation, the tops of the heart, instead of contracting, they're actually fibrillating. They're really not moving very well. And what that can do is cause blood to pool, form a clot, and cause a stroke. In fact, 15-20% of all strokes are coming from these arrhythmias. And now, the causes of these arrhythmias, the most common causes as we get older, as we age, the second most common cause is high blood pressure, which we talked about.
Yes.
But what's been really cool in the past couple of years is we have these new devices, such as the Apple Watch or, Fitbit or Samsung or whatever, that have come out that people can actually monitor themselves for atrial fibrillation. I have several. Sorry, go ahead.
No, you can continue.
Oh, I was just saying I have several patients who've detected atrial fibrillation from just wearing one of these devices.
Wow.
And it can literally save your life. I mean, strokes are devastating.
Yeah.
We don't have.
I was just agreeing with you. It definitely is extremely devastating.
Yeah. And so we don't have great treatments once someone had a stroke, but we can prevent these strokes from happening just by wearing these, devices. And so that's something that's really changed in the past few years. And I wish people sort of understood the power of these things.
No, I definitely agree with you. I actually have a client and she monitors because she has some heart arrhythmias. And so we're able to monitor it during her exercise using her Apple Watch and different devices that, are available nowadays. And, it makes my job easier as well. And you're able to catch things and detect things before they become a bigger issue.
Absolutely. Even 5 years ago, say, I would have to have patients hooked up to, wires with a little beeper for 30 days to try to even catch something. Now it's just, wearing something on your wrist.
Yeah. So we're getting ready to wrap up now. So do you have any last bit of remarks that you would like to tell some of our listeners and viewers tonight?
I think if you look as a whole in, cardiology and cardiac disease, which is the leading killer in the United States and around the world, I would like the viewers to know that they have the power to prevent this. And so we can do that.
Absolutely. And thank you everyone for another episode of You and Your Doctor, sponsored by All County Healthcare. I'm your host, Raymond Phillips, and we will see you next Monday at 6:30. Have a great night, everyone.